Hi, Mr. Meyer. I'm Chelsea. I'm the PA student that's working in the ED. And thank you so much for your patience. We just finished getting all the rest of your lab work and reviewed your imaging. So I know you came in to the ED today for generalized weakness. And after running several labs and also the CT scan, we were able to come up with the diagnosis that you're having, which is an acute kidney injury. So I'm not sure if you're aware, we have two kidneys, and their job in our body is to excrete waste and also filter blood. So they do a really good job at, getting rid of all the big bad stuff that we don't want in our body. So some of the labs that we did showed that you had this acute kidney injury. So there's damage to your kidney function. And the labs that show that is something called eGFR. So this is your estimated glomerular filtration rate. So this is how much waste your kidneys are able to filtrate out. And usually we want that to be a high number. We want it to be above 90 as much as possible. And yours was 9, so it was a little low. Something else, a lab that was also high, that we're concerned about is something called creatinine. So your kidneys basically, they're getting rid of those nutrients. And what creatinine does, it's the breakdown of muscle. And it's a waste product due to muscle breakdown. So normally your creatinine is below 1. And when we did the labs, it showed that it was at a 6.2, which is very high. And along with that eGFR, that filtration rate being low, we definitely know that there's a decrease in your kidney function. And it's definitely 3 times what your normal baseline creatinine level should be at, which is under 1, because you don't have any previous kidney disease or any type of cardiac disease. So we want to make sure that we hydrate you well. You also, because of your diarrhea due to the gastric bypass, you had a lot of electrolytes that were low. Your potassium was low, your calcium was low, as well as your magnesium. So we did already give you some fluids and hydrate you, which will make you feel better. That will also help improve your kidney function. But I really want to stress the reason why we think you may be possibly having some kidney injury. So you mentioned that you occasionally use cocaine. So drugs can also damage our kidneys. Because you don't have a prior cardiac history, meaning you haven't had an MI, we did the EKG, and that didn't show any type of myocardial infarction, a heart attack. But your troponins were elevated. We know that this is all related to that acute kidney injury. So we want to definitely admit you and monitor you closely. We're going to be giving you a bunch of electrolytes. Since those are low, we're going to be giving you potassium and magnesium and calcium. We're going to be hydrating you so that your kidney function can improve, and basically your kidneys can excrete all that waste, and we can get you back to that healthy level, and have you out of here shortly. I definitely, there are several other factors such as dehydration. You had mentioned in the past you were possibly already admitted for an episode of dehydration. So your BUN, which is your blood urine nitrogen level, that was also very high, which further supports that you're having an acute kidney injury, a severe one. And it was actually at 85. So anything above 20 is considered very high. So we also want to send you to follow up with nephrology. And they're the ones that look at kidneys, and they're probably going to recommend doing an ultrasound of your kidneys just to make sure there isn't any obstructions, any kidney stones. You didn't mention any type of flank pain, but we just want to make sure there isn't a stone or some type of stricture obstruction that's causing your kidneys to, basically go into some type of acute failure. So if we're able to, get those electrolytes up and get your creatinine function to improve as well as your kidneys, then you won't need any emergent dialysis. But we did already put a nephrology consult in, so I don't want you to be worried. Because the troponin was high, which is what shows that you're having some type of changes, cardiac changes, we also put a cardiology follow-up, and this will all happen while we get you transferred in the hospital. Do you have any questions for me? I hope that, you recover quickly, and I hope to not be seeing you in the future anytime soon. Thank you so much.